Hi, my name is Tiffany. I'm doing an assessment today for an assignment. Due to filming and privacy, I want my patient to not say her actual name and not say her date of birth. We're also going to palpate and auscultate over her clothes for the video. Hi ma'am, my name is Tiffany. I'll be your nurse practitioner for today. Can I have your name?
Correct name.
Your date of birth?
Correct date of birth.
Okay. Today we're going to do an assessment for your head, ears, eyes, nose, throat, your respiratory system, and cardiovascular. I'm going to have to touch or palpate different areas head to toe. Is that okay with you?
Yes.
Okay, so can you tell me where you are right now?
New Jersey.
What are we doing today?
Evaluation.
An evaluation. And what is the date?
June 4th, 2025.
My patient is A&O times 4. Her mood is appropriate for the situation. Her clothing is appropriate for the situation. Her affect, she's A&O times 4. All of that's appropriate. I'm not concerned about her inability potentially to carry out ADLs or take care of her hygiene. Her skin color is appropriate for ethnic background as well. I'm not seeing any signs of something, for example, jaundice. We're going to move to your head and face. First, I'm looking at your skin. I don't see any concerning lesions, bruises, redness, rashes, anything like that at first glance. I'm going to go to your scalp. Tell me if you feel any pain while I'm doing this, any tenderness.
No.
I'm checking for flakiness, rashes, pulsations, lacerations, scarring, or any concerning lesions, but right now I'm seeing nothing but normal findings. She also has a good head of hair, no balding spots at this time. We're gonna go on to face symmetry and expression of your features. We're gonna be looking at cranial nerve 5 and 7 for right now. So the symmetry of your face, everything is aligned bilaterally. Your eyes and positioning of your eyes is appropriate. Let's go on to assessing those cranial nerves. Can you raise your eyebrows? Can you frown? Can you smile? Can you clench your jaw for me? Do you feel any pain?
No.
Okay, so everything was symmetrical bilaterally. My patient informed me before the assessment she has had Botox recently, which is means that her facial expressions or the inability to be very expressive is a normal finding in this situation. We're gonna go on to your, I'm gonna assess your eyelids. So close your eyes, open them against resistance, perfect. I also wanna note while I'm here that your eyelids and your eyelashes look normal to me. They're not sparse, there's equal growth bilaterally. I don't see clogged pores. I don't see any swelling, bruising, distended capillaries, or anything like that. Now we're gonna go on to facial sensation. I'm gonna touch your face with a soft object and a pointy object. Please close your eyes. You'll point to where you feel the sensation and tell me, is it soft or is it pointy?
Soft. Pointy. 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 Soft.
All right, so those are normal findings for cranial nerve 5. We're gonna go on to palpating your masseter muscles as well as your temporal muscles. Tell me if you feel any pain.
Okay.
Can you clench your teeth? All right, open your jaw and close your jaw. I don't feel any clicking, no crepitus, nothing like that. These are normal findings. Let's go on to your eyes. So we're gonna do a couple of visual tests. So I have the Snellen chart over here. You're gonna read the smallest line that you can read, please. You can first cover one eye.
LTFPH.
Okay, remove and cover the next eye.
LTFPH.
20/20 vision bilaterally. That's awesome. Let's do a nearsightedness at about 14-ish inches. You don't have to cover your eyes, just read the lowest line.
LTFPH.
Okay, perfect. So we have 20/20 vision, nearsightedness as well. For peripheral vision, I'm gonna put my hands behind your head. Tell me when you see my fingertips.
Now.
That's a appropriate finding for this assessment. I also want to do the cover-uncover test. So I'm going to have you look at this object, focus on it, cover one eye. Okay, now remove the hand. Now do it again on the other eye. Remove the hand. I'm basically making sure that there's no drooping or swaying of the eye when she removes her hand, and that they can both fixate on the same object. We are going to do the Hirschberg test. I want to make sure that there's red light reflex, red corneal light reflex, which is an appropriate finding. This is the Hirschberg test, and I'm using my ophthalmoscope. So in her right eye, I am seeing that red corneal light reflex. That's a normal finding. Normal finding in her left eye. While I was there, I also noted that her optic discs bilaterally have sharp edges. The retinal background is appropriate with no discoloration, distended capillaries, cotton bodies, or anything abnormal like that. Let's go on to your extraocular motions, which will assess cranial nerve 3, 4, and 6. You're gonna follow my finger, don't move your head. And I'm just basically checking for nystagmus, which would be shaking or shuddering of the eyes. We want a smooth movement, which is what I'm finding here. And as I bring the finger in, I want both eyes to be able to symmetrically move in towards her nose. That's the finding that I found, which is an appropriate finding. Position and alignment, I see that her eyes are symmetrical and they're aligned appropriately. I also noticed with the light that we have pearl up. Pupils are equal, round, reactive to light, and they accommodate. The pupils get smaller with light. They dilate together with an absence of light. The sclera is nice and white bilaterally. I don't see any signs of jaundice, for example. The conjunctiva is appropriately colored. They're not red or irritated. They're also not too pale to indicate something like anemia. The lacrimal glands I'm seeing are not congested. I don't see any skin growths coming from them bilaterally. That's an appropriate finding. We're also going to go on to the ears at this point. I'm going to inspect with my eyes for positioning, size, and symmetry, which everything looks appropriate at this time. I don't see any concerning lesions. I'm palpating the pinna and the tragus. Do you feel any pain?
No.
I'm going to use the otoscope at this time. I want to look in the ear canals, and I want to make sure that they're not too red, or they're not reddened, that they're not inflamed, that there's not cerumen, because if there's too much, that can cause hearing loss. I also want to ensure that the tympanic membrane is pearly gray and it's not bulging, which again could indicate an infection. I'm pulling the pinna upwards and back, and I am seeing normal findings on the right, normal findings on the left. We're gonna do 3 more tests for the ears: the Weber, the Rhine, and a whisper test. The first test, I'm going to ring this tuning fork. You're going to tell me if you hear it equally on both sides or if it's favoring one ear. Is it equal?
Equal.
Okay, that's a normal finding. Now tell me when you hear the ringing stop. I'm holding the stem against her mastoid. I want to make sure that air conduction is greater than bone conduction.
Okay. Okay.
That's an appropriate finding. The air conduction is greater than bone conduction.
Okay. Okay.
No hearing loss concern at this time. Let's move on to the nose. I'm looking at symmetry. I'm looking to make sure that there's no swelling. I'm going to palpate the sinuses, ethmoid, frontal, maxillary. Do you feel any pain?
No.
Okay. Can you drop your head forward? Tell me if you feel any pain.
No.
I'm not concerned about infection of the sinuses or congestion at this time. I also want to note that the bridge and soft tissue do not feel inflamed. There's no tenderness. It didn't feel pain, right?
No.
I'm gonna go in and take a look at the nasal, at each nostril. I wanna make sure that the color is appropriate, that the septum is in the center and smooth, that there's no bulging, that the turbinates are not swollen, there's no discoloration of the mucosa. I'm finding all normal findings. We're also going to go into assessing patency and sense of smell. So first, let's do a sense of smell. Please close your eyes. What do you smell?
Alcohol.
That's right. I need you to occlude one nostril and breathe out. Breathe in. Okay, do the other side. Did you have any trouble with breathing in either nostril? Okay, so patency is good on both sides. I was also able to visualize that, and I felt that with the air coming out onto my hand. So now let's move on to your mouth and throat. I'm gonna go in with a tongue depressor. When I'm in there, I wanna make sure that her teeth are in a good state, not too much plaque, that there's no foul odor, which would indicate potentially she's not flossing or there's dental issues. I'm looking at the buccal mucosa and the gums. I want to make sure that they are the correct color, there's no lacerations, there's no ulcers, things like that. I'm going to assess her tonsils to make sure there's an appropriate space between them and there's no cobblestoning, which could indicate infection. I'm going to also activate her gag reflex, which is going to tell me that cranial nerve 9 and 10 are intact. And then we're going to do tongue movements, which assesses cranial nerve 12, and we're going to assess the strength as well. So first, I'm just going to quickly do the gag reflex. All right, that's a normal finding. Sorry about that. Let's do your sense of taste. Close your eyes, stick out your tongue, please. What do you taste?
Sugar.
All right. And then one more time. What do you taste?
Salt.
Okay, there we go. We're going to look real quick at everything that I had mentioned before. Stick your tongue out, say ah. All right, soft and hard palate, buccal mucosa, tonsils graded at a level 1. They're appropriately spaced and everything that I had mentioned before. I have all normal findings there. So with your tongue, can you move your tongue up? Point it outward so I can see. Up, down, each side. Okay. Now push your tongue here. Push your tongue here. That was the strength and the movements. That's assessing cranial nerve 12. Those are appropriate findings. Now we're going to go on to the neck. I'm looking, I'm seeing there's no tracheal deviation, no sign of JVD. I'm going to palpate for the thyroid. So can you just do me a favor and swallow? Did you feel any pain?
No.
Okay, that's a normal finding. There was no enlarged thyroid. I'm going to palpate each carotid. Normal pulse rate and strength bilaterally. We're also going to auscultate the thyroid as well as the carotid pulses. I'm checking for things like bruit or thrill. Normal findings, no adventitious sounds there. While I'm at it, I'm going to auscultate her thyroid, trachea. Take some deep breaths. Okay, no adventitious sounds there. So we're going to palpate your lymph nodes real quick. So I have pre-auricular, post-auricular, tonsillar, submandible, submental, occipital. Do you feel any pain?
No.
I don't feel any fixed or hardened or inflamed lymph nodes. Supracervical, posterior cervical, supracervical, posterior cervical, supraclavicular, bilaterally, normal findings for all of these. When I take a look at the lungs, I'm noting the skin, no concerns there, thoracic expansion, anterior and posteriorly. We have equal rise and fall bilaterally, that's what I want to see. Diaphragmatic excursion is between 3 and 5 centimeters, which is also a normal finding. I'm going to assess for tactile firmness. Please say 99 as I touch.
99, 99,
Excuse me.
99, 99, 99, 99.
There's no excessive vibrating, so we are negative for tactile firmness. I'm also going to percuss. I want to hear a low-pitched, dull noise over the lung regions, which is what I'm hearing, so that is a normal finding. I'm going to do posterior as well. Do you feel any pain or anything?
No.
Normal findings here. Let's listen to the lung sounds. I'm going to be listening to bronchial, vesicular, and vesicular. I already listened to the trachea. I want to listen to the top lobes, all of the lobes, and make sure that I am not hearing any adventitious noises, such as wheezes, stridor, or crackles. So I heard lung noises in all of them. They were present in all areas. No adventitious noises. Please breathe in and out deeply. Good. I'm doing the same posteriorly. Normal findings posteriorly as well. So we're going to move to the heart. I'm going to auscultate the heart noises. I want to hear S1 and S2 in the aortic region, the pulmonic, Erb's point, excuse me, tricuspid, mitral. I hear S1 and S2. I don't hear any murmurs or anything like that. I'm going to have my patient please lie down. Once you lie down, please raise your head at a 45-degree angle. Turn this way. I'm assessing for JVD. Turn this way. Thank you. You can rest your head. I don't see any JVD present. Normally, I would inspect under the clothing. I'm not doing that for this video. But now I'm going to auscultate the aorta, the renal arteries bilaterally, the iliac arteries bilaterally, femoral bilaterally. I'm able to auscultate in all areas, which is good. I'm now going to palpate aortic, renal, iliac, femoral. All of the strength is 2+, which is normal. I'm going to the brachial arteries, the radial arteries. I'm also assessing that they are equal strength bilaterally and palpable bilaterally at the same rate. This is popliteal, posterior tibial, and now the dorsalis pedis. They all have the same strength and the same rate bilaterally. Thank you so much for being my patient today. Thanks for watching.